Welcome back, podcast listeners. This is episode 8 of the Just True podcast. And today's guests we have on are Rachel and Vanessa Van Cleef. They are my cousins, more like sisters. We've grown up together, we're very close, and they are both registered nurses. So today we're talking a lot about the healthcare system from a nurse's perspective. If you're in the healthcare system, I'm sure you can relate. If you're not, just as good of a podcast, an introduction to kind of what's going on and what it was like during the pandemic and just what it's like from a nurse's perspective. They both also teach newly graduated students on the floor in the hospitals and train them to be nurses. That's it. I hope you enjoy. Today's cocktail is ironically called the Burnt Out Nurse. And for those that are nurses and especially have worked during the pandemic, I think you can kind of get why we called it this one. We're gonna peel, slice up a peach. I would do maybe a quarter cup of peaches. We're gonna muddle this with a slice of lemon. I took out all of the rind and extra bits of the lemon there to just leave the lemon pulp. I guess you could also substitute lemon juice if you want. After it's finely muddled, add bourbon or any of your preferred whiskey in this case. We're gonna top this with ginger beer. And I made this a little bit interactive. I put grenadine in syringes and I had my guests actually help make the cocktail themselves. Slide this glass to your guests, have them put however amount of grenadine they want to add into it, depending on the sweetness level that they prefer. We're going to take a piece of mint, smash that up in your hand to break up the flavors and the smell. Put that in, give it a little bit of stir. So we're going to take a peach slice, roll it in sugar, slide it onto a skewer, and we're actually going to caramelize the sugar on this peach with a blowtorch. All that's left to do is a pinch of cinnamon, and that is the Burnt Out Nurse.
Hey you, you're listening to Just True, Just True, Just True.
Oh, this is good.
Yes. It is good.
Usually I do a test one the night before.
Yeah, it's good.
Yeah, we need to think of
10
a name.
out of 10. You have to think of a name.
The Burnt Out Nurse is hilarious.
Yeah,
I like that one.
Yeah.
The torched nurse.
The torched burnt out nurse.
We're live, yeah, Drew? Mm-hmm. Nice.
Woohoo.
Woo.
Yay.
We made it.
Wow.
Finally.
Thanks for coming on.
Oh, no problem.
Thanks for having us.
Them city kids don't know their way out here in the country.
Well,
Yeah, Vanessa doesn't want to talk about it.
my GPS failed me.
That's all right. The one time I had Matt Hagopian come out for a magazine shoot in Long Point, and he knows I live in Port Dover, and I guess there's an exact address, but in like Fisherville or Otter, no, what's the
Fisherville?
Fisherville. That's it.
This country gal is knowing her towns
So
now.
he went to Fisherville and he's like, I don't see you. And I was like, I don't see you. He's like, go outside your house. And I'm outside my house. I'm like, I don't see you. He's like, I don't see you. And I'm like, where are you? He's like, I'm in Fisherville. I'm like, Matt, you know I live in Port Dover. And then he made it, and then it turned out okay. So
Yeah,
That's good.
Got us some slack.
yeah. So how's that nursing life? Did we anyone work any shifts last night, or?
No,
Well, I
not.
guess you wouldn't be nights.
They
Yeah.
both asked us to work today, but we couldn't cancel on you again, so.
Yeah.
Aww.
Yeah. I'm like, we can't do that to the Drews again. So
We appreciate
I am
that.
coming off 3 nights, so bear with me if I,
Oh boy.
zone out a little bit. So I had that quad espresso on the way here.
Night quad 4 espresso. That's like your daily limit.
I feel like we're built a little differently when it comes to caffeine.
Built different.
I could go right to bed after it, to be honest.
Yeah, I was, because I watch, like, my dad only drinks tea, but I'm like, a shift worker must be so out of whack. Like, what is your shift? Because my dad is 2 weeks days and then 2 weeks nights, and that's kind of how it alternates. Is it the same?
Well, because he's full time, and I
Yeah.
know he follows that like the 2-3 schedule. So you do like the 2 weeks of days, 2 weeks of nights, which I used to do that. But both Ness and I are part time, so essentially we could do days or nights. It doesn't have to be a certain length of period of time.
Yeah, it's random.
Like we could do like 1 day and then have 2 days off, and then 2 nights, and then 2 days off, and then a day. Like it's very
Yeah. And we both
sporadic.
teach nursing students too, so we flip back and forth all the time. Day, night.
Yeah,
Zombie
like we're
mode.
both teaching. No, you're teaching Wednesday, Thursday. So you'll teach tomorrow, and then I teach Thursday, Friday.
Yeah.
You do
sprinkle
two-
a few
yeah.
nights in there, and then
Yeah,
I see. Okay.
Yeah.
And where do you teach?
we're both at the hospital we work at, which
Okay.
is nice. So Rachel's on a surgical floor, and I'm on a medical. We kind of bounce around whatever's available. It's like a contract type deal, but it's fun. Get different levels of students. This is a spring term, so it's really quick. It's what, like 6 weeks, 5-6 weeks?
Yeah, 5-6 weeks, 2 days a week. But then like a regular semester when it's 12 weeks, you do like your 6 weeks, your reading week, and then your 6 weeks, and it's just 1 day a week.
And we're on the floor with them on the unit, right with them, helping them with skills and stuff.
Okay, so it's
Alongside the
right on site
nurses.
at a hospital, not at like an institution.
Correct.
Yeah.
Okay, and are these are they almost nurses? Are they nurses?
Almost.
Almost nurses.
Yeah, so some of them are just starting their schooling, so it'd be like their very first placement. Where last semester from January to April, I had a group of students. It's called like the accelerated stream. So they've already done a degree in like kinesiology or health science.
Oh wow. Okay.
And then they're doing like the accelerated nursing program. So is that 3 years?
2.
2 years.
It's a crash course. Yeah, it's quick.
So they do like their 2 years to get their Bachelor of Nursing, and then they can go right in and do their license and then get a job.
Okay.
So that was their very first placement.
Most of the time, first time ever in hospital.
Yeah.
So it's pretty fun.
Yeah, it is
Yeah.
fun just to kind of see them experience like new things, and you'll say something and they'll be like, "What do you mean?" I was like, "Okay, like we are actually starting at square one here," which is fun. Like you can help mold the kind of nurse that hopefully they'll be. Yeah.
There must be some bit of a culture shock. Like, have they come in? Like, is there nightmare scenarios going on while they're teaching, or like how does this work? Are you on the floor? Are there patients around?
Yep.
So like shit could go wrong.
Oh,
as
yeah,
you're
definitely.
teaching.
And it has gone wrong, but we're there's the resource. So usually we'll buddy them with the nurses that are working on the floor. And then we help them with things like meds and question their thinking, and
Okay.
because they'll take a patient ultimately and be caring for that patient with support from us and the bedside nurse. So
Okay.
yeah, there's a little bit of risk with it, but you hope your students know when to ask questions and can come to you. And
I just in my head I picture like the TV shows, and we're like, oh, he's dying. I need whatever stat, and then you're like, and the patient, the students in the corner like, we're rocking back and forth. Like, that would be me.
Yep. No, that happens a lot.
I think like me and you had similar first days. So the group I just finished with, that was their very first hospital placement. The first day we go in, first time in hospital, first time on a floor with patients.
Oh boy.
And it's 7:30 in the morning, and a patient was palliative and they had passed. So they come to me.
Can I ask what palliative is?
Yeah, so a patient that's palliative essentially like doesn't have a good prognosis with their disease.
Okay.
So it's kind of like you have like weeks to live, days.
It's
at this
looking
point.
grim.
The focus
On
is
their
on
way.
comfort care, end of life care.
Yeah.
Okay.
So we typically, like on the floor that I was on, there is a palliative suite. So they're in their own room. There's couches and a TV for family to come in and stay with them. And yeah, we just provide comfort until kind of that last moment of life. And then that patient happened to have passed at like shift change. So it's 7:30 in the morning. First time in the hospital on the floor. I've paired them with their nurses, and then the charge nurse comes to me and says, "Hey, like, do you and your students want to provide?" It's called postmortem care, where you kind of have to take off all their dressings and take out their IVs and clean them up and put them in a body bag, which is quite morbid. Considering
it's a lot for students.
Yeah, it's a lot for them to take in, a lot for them to handle. So I wanted to make sure first, let's do a debriefing session before we even go into the room so I can prepare them for what they'll see.
Like at least the first time I saw one, it was quite a shock.
Yeah.
So.
Yeah.
And a lot of these kids are early 20s. If you have them not in the accelerated, they're like 18, 19. And seeing someone that's passed for the first time is pretty tough.
Yeah, seeing
You don't
one
really-
and then
Yeah.
touching them and
Yeah.
You don't know how to act or how to think or how to feel.
Yeah.
It's tough, right? So
Yeah. And I don't know, like, it's kind of crazy that, like, I've dealt with a lot of palliative patients and had to provide that care for them when they've passed. And it just, like, it's sad you become numb to it because you don't want to be attached and take that home. So they're probably thinking, wow, this girl, it's just another day of her doing this. But they probably were very, like,
rattled.
Yeah.
And then they see you, you're very calm.
Yeah.
But it's not the first time
Yeah.
that you've seen it. I know I've asked my dad about it because he's there at the scene of accidents. And I'm like, he's like, oh, you just have to tell yourself, like, I didn't cause it, but I'm now here and I'm here to help.
Right.
So it's like you can't stop it from happening, but you can't help what has already happened. So I'm like, but still, that's like,
Yeah, it was a pretty heavy first day for them.
I wouldn't be able to handle that.
Yeah.
They did really well. I was proud of them.
That's when my semester started last semester too. It was someone that had passed, and it's a good learning experience. And I said it's better to experience it now than when you're on your own as a new nurse and you're kind of more on your own. At least we have the time as a group and they have us to go through it with them. But yeah, there's usually some tears, some, confused emotions, but
Well, because it's all theory up until you walk into a hospital.
yeah, and then it's like, bam, welcome to the real world of nursing.
Yeah.
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 And when, let's say it's their first actual shift, like, are they being, because obviously they're new, are they still paired for a while until they can kind of be independent?
Yeah, it depends where you end up working, but a lot of places will have some form of orientation, whether it be a couple weeks to maybe it's more specialized unit where you train for a couple months with somebody. But yeah, you're always paired. You have to get signed off on certain skills and things. Now it's changed a little bit since COVID and them being short-staffed a lot, but for the most part, you do get an orientation.
Okay.
Yeah.
Because I think before COVID, nursing was like one of the biggest boom. Like everybody, it seemed like, was going into nursing. At least from my perspective. Like when you first started going to school, was it like a big influx of people going to nursing school?
Yeah, it's a very competitive program.
Okay.
Still is. Like you need a pretty high average, which I don't understand why, because we need nurses. So I don't know why. Like,
You have to know what you're doing.
yeah, but some people can be extremely book smart and have like a 95% average, or there's someone that has like maybe a 79 average and is really good with people and has really good common sense.
Yeah.
So I don't know. I just think.
But it's hard to judge that at a university.
Oh yeah.
It's like, how do you test for that?
Yeah.
I would be more the common sense person.
Yeah.
I can't memorize things well.
Well, I don't like tests. I had to study very hard. In nursing school is probably the toughest 4 years. I remember I was just studying for my first set of finals and I looked at Vanessa and my mom like, I'm dropping out. I can't do this.
Yeah.
I'm going to find a different profession. And they're like, no, you're fine.
We talked her off the ledge a few times.
Yeah.
Nice.
Yeah. I tell every nursing student you almost need some form of therapist or someone you can talk to because it's an emotional roller coaster. Yeah.
It's got to be intense.
It is intense and it's changing a lot. I know from when I started, I've been a nurse for 9 years now. It's crazy, but it was almost like there was a lot of bullying. The senior nurses were not taught, but like it was the culture to eat your young. And that's how you learn, through being eaten. And
kind of like prove yourself.
You have to start at the bottom and work your way up and, move your way up through the ranks. But it's changing a little bit, which I like.
What is that like? Like, are they mean?
Yeah. Some of them, I remember coming home in tears in my first job. More specifically when I got into critical care, where there's a lot more acute scenarios, really sick patients. And you tend to beat yourself up because, they've worked there for 30 years. I'm a 25-year-old just trying to figure it out. They've worked here longer than I've been alive.
Yeah.
And they're making comments, things you should do differently. Like, yes, we're trying to learn and try our best, but it can really start to wear you down. It's a lot of negative. Now, not all of them are like that. I don't want to paint the picture that all, senior nurses are bad, but there was quite a significant amount, and I think it's changing. I know for both of us, nursing school was really hard. And I think we just want to change that, which is why we love the teaching. We want to foster a very positive, nurturing environment where students actually feel comfortable to ask questions. Because what was happening is nurses would be scared shitless to ask the nurses that actually had experienced anything, because they'd be scared of, feeling stupid or dumb or, things like that. So it is changing in a more positive way. I tell them you have to advocate for yourself. Don't be, a pompous ass, but you have to you have to stand up for yourself and your patients and,
And you have an HR, I would assume.
Yeah.
Yeah.
But they are afraid to go to HR and be like, hey, this person is an asshole.
Yeah. Well, a lot of stuff you kind of just deal with. Like, it's just
it.
how nursing is.
It's the culture.
It's the culture.
Yeah.
You can't change it overnight. It's just how it is. There's some pretty spunky nurses out there, let me tell you, some fiery ones. So, but again, it's just any job, right? You got to deal with different personalities. But
yeah,
it's hard because you have patients' lives in your hands. And then you have to care for yourself too, right? I think a lot of nurses sacrifice their own mental health to care for others, but
Which I also think that's changing.
yeah,
I feel like back then, like nursing was your identity, and that was your life. Whereas like now, I love my job, and I feel like I'm good at it, but it's my job, and I have tried to separate and kind of do that nice work-life balance. Because I used to be full-time. I needed to be full-time to get a mortgage. But as soon as I got that mortgage, I wanted to go back part-time because where we are, you can put in your availability. So say our group of friends wants to go to a cottage weekend, I can put not available. Like I don't have to worry about requesting vacation and getting denied. Oh. Yeah. So that's
like a balance.
A huge, or like a simple concert. I can put not available. I can go to the concert and not worry about getting denied or finding a switch or...
Yeah, and especially you're still in your 20s.
Yeah.
Like you want to do stuff.
Not me anymore.
Yeah, you don't have a family or kid. You're not like, yeah.
So it's tough. I think COVID changed that for a lot of us because I also was full-time during COVID, and you sacrifice a lot. Holidays, birthdays, family events, all the big things. And, you know, we were short-staffed. You wouldn't get granted vacation or things like that. And it can really wear you down. So I think it's nice that we finally come out the other side and actually like life, and it's there ultimately to pay for our life. Yeah, we love our work, we love our coworkers, but it's nice to have that balance. And I hope that people that are struggling out there can find that balance, because I think a lot of times people stay in a spot because they're comfortable. But good things happen when you force yourself to.
Or bills. I know people are
bills.
just like need to pay for things.
Yeah,
just like mortgages, the rates going up and down.
Yeah, you need some sort of security, right? Which part-time, there is a risk, you know, that you're not going to get shifts or you're going to get canceled, which has happened. But luckily, we both have multiple jobs, so we make it work.
Yeah, you teach as well.
Yeah.
So we find a way.
Which is good.
Yeah.
Do we want to dive into COVID yet?
I don't mean, how morbid do we want this?
We've kind of touched on COVID slightly, but we can...
Well, I'm just looking at Drew like, what the fuck was that like?
Can you bring the mic down just a little?
Mine?
Yeah, just down and point it up.
Is mine good?
Yeah.
Yours is good.
Okay.
Yeah.
Just so it's not blocking your face from the camera.
Yeah. I mean, it's okay
so
if
we
they
can
don't
see your
my
beautiful face. I push it and aim it up.
Okay.
Yeah, you're good. Yeah, just like that. That's perfect.
There you go.
And you can hear how well you sound because your headphones are working now.
That's true.
Yeah, what the fuck was that like?
Well,
I'm just like, I feel like I feel like everybody's going through some sort of traumatic experience, just going through it in general. And then there are nurses like you who are in the hospitals and seeing it firsthand and being exposed to it like every second of the day.
Yeah.
Why don't you start?
Terrifying.
Yeah, I'll start. Because I was finishing my nursing degree in 2020 when COVID was starting.
Good timing.
I know, it's just impeccable timing. So I was like, things were kind of going around in the media. I was trying to finish my hours because you have to have so many hours to meet, what is it, like the CNO requirements.
Like the College of Nurses.
Yeah, to be successful and graduate from the program. So I was like trying to pump out these hours. I wanted to finish a little bit early so I would have time to study for, it's called the NCLEX, to get your license in order to work in Ontario. But all of a sudden, like, we got an email. I think I had maybe 5 shifts left to complete, that it's canceled. You're not allowed to go to clinical. School's canceled. We got one email and then like 2 weeks of silence. So I was like, am I graduating? Will I have to wait till this kind of all like simmers down? Which it took, 3-4 years to finally simmer down.
Yeah, what happened to 2 weeks?
Yeah, I know. So I'm just like sitting here for 2 weeks. I'm like, kind of in limbo. I didn't know what was happening. And then all of a sudden I get an email from the College of Nurses that they've received like all my information that I've passed and graduated.
So they just kind of gave you those 5 days?
Yeah, and some, like, you're not supposed to, but I kind of front loaded my hours. And some people had like close to 20 shifts left. I forget how many shifts you need. I know it's increased now,
and
but
when you got this email, was COVID a thing?
Oh yeah, like
so you knew about it. It was kind of circulating.
Yeah, things were shutting down. We had our bubbles and all that stuff.
So I got the email that I graduated. Woohoo! Didn't get a graduation. Didn't get to walk across the stage. Essentially, we were almost in lockdown at that point. So I just used this time to study for my license exam. I wrote it right away. I got a job right away, which I don't know. I could have waited, but I also needed money because I just finished a 4-year degree. And then I went right into kind of the work field. Got a job where I had a level 4 placement. So it's one of like your last clinical placements in the last year of nursing. And like I was pretty lucky because I got a job where I knew the staff. I kind of knew what I was walking into, but not really because now COVID was a thing. And then now just training as a new grad while also the weight of COVID on your shoulders was, I don't know, I don't think I realized how big of a challenge it actually was until looking back.
Yeah.
Because there's so many more obstacles and so many more things you have to take into consideration, especially being a new nurse. Like didn't even think I knew what I was doing for like the first couple months. And then having to navigate all these different policies and protocols. Yeah.
Well, and people were off sick and we were working short staffed.
Yeah.
And I think it kind of escalated a lot of the senior nurses to retire.
Yeah.
So people that you looked up to for advice and if you had questions that had been there for years and years, that wasn't always the case, you know, during COVID. So I think that was a huge barrier for new nurses starting.
Yeah.
You're
Those mentors are leaving early.
Exactly.
Yeah.
And your mentors
Because-
on the unit now are only there for a couple years.
Yeah. And I can't blame them. Like if they have a year or two from retirement and then a pandemic hits.
Yeah,
it's
I
like,
would retire.
Oh, I don't blame them at all.
Yeah.
Say, go, run.
So
be happy.
like not even 2 years in, I ended up like being charge nurse on nights and like just like you said, that support and people that you can look to were no longer there. Like my old unit that I used to work on, there's still like a good majority of senior staff there that kind of helped steer the ship, but they're all slowly.
Yeah, not every unit was like that unit.
Yeah,
either.
I was very lucky. Like it was a specialized unit with like cancer patients and immunocompromised. So any COVID patient, they weren't allowed to be on our floor.
So they called it like a clean unit.
Yeah.
Okay.
So I was very lucky in that instance, but just a lot of like the short staffed and we were being floated to any unit that needed staff if our staff was like full. I had to go to ICU. I wasn't trained in keeping a patient with that had.
I was going to
like-
say, do you have to train differently for each unit?
Oh, yes.
But you're just getting floated around.
That's what these hospitals tend to think. A nurse is a nurse. That is not the case.
Yeah.
You work on one unit with very specific skills and qualifications. They think you can just float to another unit and just pick it up and go.
Who's they? Who's deciding that you're going to work here
Who
today?
is they?
Who is this
deciding?
person?
Management, site administrators, essentially, like I get it because they're looking at the hospital as a whole and saying, look at unit A is 10 nurses short versus unit B is 2. So we're going to share the
level
love.
it out.
Yeah.
Have these administrators been nurses themselves?
Probably not.
So they
Most
don't
of them no.
most
So they don't even know.
No.
And certain units, yes, it might look on paper that it's uneven based on, say, staffing levels, but they failed to look a lot of the times at acuity or, like Rachel said, the unit she was on had a lot of really invasive surgical patients that would have like tracheostomies and really specialized wound care that not everyone knows how to deal with. So they were chucking nurses around. And again, it's a safety thing too, right? Like you're not caring for the patients properly because you're not trained there. You don't know where the stuff is. You don't know who to call in an emergency because it's different on every unit. Just all the little things that can add up. And it's scary, right? Especially someone that's new that doesn't have the experience or maybe he's only worked in one place.
A literal student, like you're pretty much a student still.
Yeah.
Yeah.
A student
Yeah,
with
like you
a,
graduated, but
with
it's
a
like,
license.
Yeah,
Yeah,
student with a license.
Yep.
Yeah.
and then it's just like boom, pandemic. Here, go here, go here, go
Yeah.
here.
And then they
Yeah.
wondered why in the first year, I can't remember the stats, how many nurses were leaving bedside. Yeah. Because we're in a shortage. We have been for a decade. They've been trying to sound the alarms like our union and things to say, but a lot of people just didn't think it was worth it to stay because of the emotional stress and turmoil and lack of support.
So if that's better, then better retention of nurses.
Yeah.
Yeah.
You would hope.
I mean, you also slap down things like Bill 124, bringing in politics to it that capped our wages at a 1% increase, us, teachers. So it was frustrating when
Was
we're...
this Ford?
Ford, yeah. It's frustrating when we're, essential services, going to work, just trying to care for people.
In a shortage.
In a pandemic.
Post-pandemic or in pandemic.
Where realistically the cost of things, we need a paycheck, right? And when you try and wage whether your job is, worth this mental torture, do you know what I mean? Like, it's tough when you see fellow, frontline workers getting raises and not dealing with half the things that we're dealing with.
And like, you feel like they're being valued and what we're doing And
we're working short staff. We're ultimately doing the jobs of 2 to 3 nurses and getting no compensation. Now, it shouldn't all be about money, but money rules the world. Really.
Yeah, but if you're putting all that extra work in and you're like constantly in traumatic situations, like,
it wears you
some money would be nice.
Yeah.
Mm-hmm. So that kind of just a slap in the face. Like, nurses are heroes. We need our front line. Not just nurses, all healthcare workers.
Which I feel like a lot of citizens, feel that way. But then it's the upper politics, like Doug Ford, who are like, fuck you.
Yeah.
It's tough.
Essentially.
And then we've got the public thinking, oh, nurses get paid enough. Nurses. And it's like, yeah, well, it's a reasonable wage. But now that we're doing the job of 2 to 3 people.
And we wear a lot of different hats, too. Like, we're not just a nurse. Like, we kind of play like a social work aspect, a physiotherapist, an OT.
Cleaner.
Yeah. Like, literally all the hats you can think. Security.
Yeah.
Like, and like anything you can think of.
You have security, no?
Yeah. They get there when they get there, though. Like, who do you think's dealing with these people
if you have
until they get there?
Like a delirious, violent patient that's not responding well coming out of anesthesia, we're there already, so we have to try and control the situation until security gets there.
Yeah.
And, like, here's little me, 5'3", blonde nurse, trying to sometimes
Wrestle
6'2", like,
you know what I do?
Man.
Here's some sleepy juice.
give me a little birdie.
Give me a little birdie.
Just kidding.
Yeah.
So,
It's tough, right? Like, and then you keep piling on these different responsibilities, again, due to shortages and whatnot. It burns people out. And then people are calling in sick. And then you're in that vicious cycle all over again.
So when you say you're working 3 jobs in one, has that changed because of COVID? Or, like, is it just because of the shortage? Is that why?
Yeah, I think mostly. But
have they just been piling extra tasks on top of the already existing position?
Oh, always,
Yeah.
I think it's just more so amplified now.
Yeah.
Before the pandemic, but now, like, with staffing shortages and.
Well, it's hard too. Like, hospitals have to upkeep their level of whatever they have, professionalism, accreditation, we'll call it, and they have to ensure their staff are meeting these. So they would honestly pile things on. Oh, make sure you chart this every shift. It's not for the safety of the patient. It's to ensure we're meeting all these competencies. So it's just like charting additions and monitoring. And again, with COVID and the swabs and wearing all the levels of PPE and there's a lot of stuff that was added. It's, it sounds probably like we're just complaining, but when you're in it and it goes from one extreme to the next.
And especially being new.
Yeah.
My brain wanted to explode after each 12-hour shift.
Yeah.
Yeah.
No kidding. Also, 12-hour shifts, like.
Yeah. Wearing an N95 for most of it at one point, remember? And then, we only got 1 mask. So we actually had to keep it in a paper bag at one point.
Yeah.
Oh.
Because remember, there was a shortage of masks at one point, too.
And, like, no water at the nursing station.
Yeah, we couldn't hydrate.
What?
Yeah, they would throw our waters out if we had them in the nursing station.
Contamination.
Yeah.
Because they don't want you pulling your mask down.
Yeah.
How else are you supposed to drink water?
Very careful.
Yeah.
Whoa.
On your break, if you got one.
Just move it. Yeah, perfect. You're good.
I'm causing problems.
No, it's good. Just want to make sure you're nice and crystal clear. Yikes. So I'm trying to like think back to the pandemic and like there weren't even vaccines out then. So like you're working around pandemic patients without a vaccine.
Yeah. And everyone was scared.
Hoping you don't get it.
Yep.
Yeah.
You see the news, right? I remember seeing on the news of Italy and they were bringing in all these trucks for all the patients that had died. And like I was in ICU at the time and the ICU, it was a cardiac surgery one. We'd be canceling all the elective procedures to prepare for this influx of really sick patients. Yeah. So it was kind of eerie. We were sitting, waiting, practicing proning people, thinking that it was going to be catastrophic. It ended up being okay, but some centers weren't as lucky. It just kind of depended where you are in the region. But
then, like, we also became, like, consumed by it. Like, I had to not turn the TV on
Yeah.
anymore because like we started to spiral. Like,
Oh,
as
yeah.
what are we gonna walk into tomorrow? Like, I've developed so much anxiety. I think
Oh, yeah.
from
I think everyone did.
Yeah, that just like learning different coping mechanisms and just talking about it, and I don't know. Try and suppress a lot of things.
Yeah, like I wouldn't even allow myself to go on Instagram or read the news because
Yeah.
after an hour, I'd just be like a ball of anxious mess.
Did the government offer you anything during that to help? Like, did they have
No, 'cause our
outreach
wages were
programs? Oh,
No, they did that thing where they banged the pots
Oh,
and
yeah.
pans.
Oh yeah,
That
that's
was
when we would
helpful,
come
right?
home
They
from
banged,
work or
yeah, we got a
something.
couple
wait, I missed this.
coffees.
Oh, there was like, I don't know what it was. It was not a parade, but it was like,
People would,
Oh,
bang their pots and
now it's coming
pans.
back to
Yeah.
me. Okay,
I don't know.
how did? Yeah.
Apparently it did something.
Did it help your mental health at all? No, I'm just kidding. I
No.
appreciate the support from everybody, but it's
Yeah.
like,
Yeah.
yeah, like, are they giving you benefits for a therapist? Are they having like outreach programs? Are they having people come in teaching you coping mechanisms? Like, do they teach you that in school or during training or like how to deal with trauma?
They did a bit, but I think there's more of a focus on it now.
Yeah.
And I think into the pandemic, they tried to increase mental health support for staff and things like that. But again, you know, you're getting called into work all the time. So when do you have time to take care of yourself and do that? And I know a lot of people, myself included, were coping in ways that weren't the healthiest either. And you're trying to look out for your work family because you get really close with them. I loved a lot of this. You know, they're some of my best friends. People I'll think about forever. But you bond through the trauma.
I was going to say one thing you texted me was trauma bonding.
Yeah.
The term trauma bonding.
Yeah. That nothing makes you closer than having your hand on someone's groin who's bleeding out post procedure. So it's I see Smith at his
He's
drink.
like, could you have
Sorry,
waited?
Well, I know military guys will talk about it, about this like brotherly bond that they have because like when you're under fire, like both of you could die and you're depending on each other.
Yeah.
It's got to be, not that I'm comparing nursing to being in a firefight, but it's got to be very similar mentality of like,
Yeah.
you know, you're suppressing this artery and this guy's gonna bleed out and die. And
Yeah.
like, how do you
You just
compute
You
that?
disconnect, honestly. Like, I'll never forget, I was in like it's not ICU, it's like a level below, patients that are still critical. And he had quite a big surgery and wasn't doing well. And we just kept hearing him cough and cough. So I was like, I'm going to go check on him, make sure he's okay. His carotid blew.
You told me this on its own. He had surgery, right?
Yeah,
But
like he's a cancer patient.
friable
and-
tissue
Yeah,
and-
very, very friable tissue. And he had like an artificial airway put in.
Sorry, we
Got a piece of peach.
Yeah.
Continue.
But yeah, his carotid blew, so blood splattered all over the room. And there's me,
he has to turn away.
I'm not.
and then
Yeah.
there's
Your stomach's not
me
built for
and
this.
No.
my friends who were working in that little area at the time. Like, one's putting pressure on the neck, one's suctioning, one's calling the blood bank because it's called a code omega when there's excessive blood loss.
Yeah.
And
You just go
kind
to autopilot.
yeah,
Yeah.
like very like all hands on deck. Like all the critical care teams responded, and then it was like 3 hours until we could get it under control, cleaned up everything, and then you just like sit down and chart.
And continue.
So, how was your kid's hockey game last
No,
night? Like,
seriously.
Yeah.
Oh, I'm gonna go get a coffee now.
Yeah,
And meanwhile, the rest of the unit's still functioning as normal. Like time doesn't stop.
it's crazy when you think
Yeah.
about it.
oh my god! And then you like see me at Christmas dinner. Like, what have you been up to, Drew? Oh yeah, I like did a podcast.
I'm like, that's
What did you do? Oh, this guy's artery exploded out of his neck. This is what my Christmas dinners are
Yeah,
like.
we're all
that's
in
a lot.
healthcare.
That's a lot.
Like my entire family.
Yeah,
I don't even like watching Grey's Anatomy. Like that's too much for me.
and that's unrealistic.
Yeah,
That's it.
yeah.
Yeah, I can't watch gory
No.
stuff.
No.
Yeah.
Yeah, so picture things like that happening often on your shifts that you don't even have time to process, and eventually, like the drink, you're gonna get burnt. You know, get burnt out.
Yeah, the burnt out nurse drink.
I like that name. It's a
I
good
do
name,
too.
I
I
think.
think it's sticking.
The burnt out
Nice.
nurse. Yeah, so trauma bonding. Very
It's heavy.
yeah.
Yeah.
You make some of the best friends.
Does anyone from administration or, I don't know, from your union or whatever, HR be like, how are you doing?
They try. Like, they'll send out surveys and stuff. And I filled out every single one of them. I was always trying to advocate, but...
I am doing bad.
Sad face, sad
Send
face,
help.
sad face,
Send
sad
help,
face.
please.
Yeah. No, honestly, I think the biggest thing is we were just trying to be there for each other.
Yeah.
You know, if someone needed a mental health day, you didn't shame them. You said, no, call in. Take a day for yourself if you need it. Like, a lot of us were really struggling, and I don't think we really realized it until after, when you actually have time to reflect. That's a huge thing in nursing.
To actually process what just happened.
it.
Yeah.
Like, a lot of the stuff during COVID, the couple of years, like, I worked in a level 1 trauma center. I was on the code team I was in the clean unit, so we didn't get the COVID patients, but I was floated all over the hospital. And every day I'd come home, and poor Adam, my fiance, I'd be crying. And I didn't even know why, but I'd just be sobbing and just trying to numb the feeling, because then you have to go back in and put your mask back on, put your nurse personality back on, and just care for these people. But meanwhile, your soul is like withering away. And after I lasted 2 years, and it was the best group of coworkers I'd probably ever had, but we were all struggling from the weight of it all. And you can only take that so much before it snaps, you know? It's like
I was like, quit. Leave the unit.
Yeah. Luckily, financially, I could. But
yeah.
I'm
But
in a
you
better
quickly
place.
found another job. But I think the most difficult part was leaving that group of people where you like bonded so closely with and went through really like extreme highs and lows.
Traumatic things.
Yeah.
Like I said, I was the most junior I was full-time. Every other shift, I'd be floated all over the hospital. And like we said earlier, a nurse is not a nurse. So we'd be going to units. I'd be going to units I'd never been to before, never been trained on, and you're just expected to just pick it up and go.
Yeah.
And I remember texting you a lot of the shifts, like in tears, being like, I can't do this, you know.
I feel like most people just from TV shows are like, oh, nurses, ER. They think about the ER, which is like the first contact, but there's so many.
Oh, like
so many units.
It's a lot to uncover.
Yeah, and I was at that hospital for a long time. I ended up quitting, but I had to because I was losing my mind. And it's nice to look back now and realize, in the middle of it, it was not good. But
like you had quite an intense experience during COVID where I was more so lucky that even though I was a new grad, I went into a unit that was specialized in like a clean unit, and I was well supported. Like the senior staff that was there was like a really good resource, and I could always look to them. And the fact that I didn't have to deal with COVID patients and kind of focus on the specialized patients that I was trained to care for. But like still like the floating and everything, but like I don't know, what the hospital that you were at was just like on another level and
we didn't rotate. And I, again, advocated for myself and the same like 5 of us that would get floated. And they were burning out the same 5 or 6 of us that kept getting chucked around the hospital. You know, it was horrible.
So not like distributing it. It's...
No. And
where the hospital that we're at now, where I made her come to, everyone takes a turn.
We take turns. So it rotates through the
whole
long
unit.
list of staff. Instead of burning out the same few people. And I tried to change it at my old unit. There's not really anything in writing that says to. I think it's just, again, a culture thing. It's hard to change. So ultimately I ended up leaving. But it was hard, you know. Like, I hate the term family, work family, but they were my work family. I still care for all of them because, again, we went through some really crazy shit.
Yeah.
Wow. This has been really dark.
No, it's just like
I know.
Post-mortem care and now COVID. There are positives to nursing. There are.
Yeah. So how do we how's it been since COVID? Like, is it worse? Is the medical system, as far as nursing goes, is it worse off since COVID? Has it improved? Is it better? Is it the same?
I think we're like in this constant state now of catch up.
Yeah.
Patients that weren't seen during COVID, surgeries getting canceled, appointments getting canceled. There's
no family doctors.
Yeah, like they're way further along in their prognosis than they should be too. So like you're seeing sicker patients, tons of surgeries, like it's never ending.
And people
honestly.
that can't care for them, like maybe they can't afford medications or they can't, take the time off work to go to appointments or
especially with like inflation.
It's overloaded for sure.
The cost of living. people can't take care of themselves even if they wanted to.
Yeah.
I was talking to Nana was over last night.
Yeah.
And she's 85 and she has to pay $300 for a pneumonia vaccine. And I'm like,
not everyone has that extra cash.
those are the most prone people.
I know.
Like, I think anyone over, I don't know, 80, 75 even,
at
like,
risk,
you should, I don't know, that should be covered.
Yeah.
Yeah.
That's insane.
And it's crazy to me, like the general public has no idea what state our healthcare is in. That's why I think it's frustrating, because they'll go into the ER and be pissed off that there's an 8-hour wait. It's like, well, they're taking people that are actually dying right now.
Yeah.
Versus you that's had a, ingrown toenail for 2 weeks. Like it's
Or some, you just need some stitches or something.
But again, that's lack of them being awareness of where to go. We've got urgent care centers, we've got clinics, we've got,
just seeking out like the proper facility, I think, is like huge, and people aren't educated on.
And we're still in a major staffing crisis too. So like I know ICUs are still struggling, ERs are still struggling. They're filled with mostly new grad hires that again don't have the years or experience. People might think, oh, they're a new nurse and they're licensed, but no, it takes years to get comfortable.
And that'll slow the system down just because they're not as experienced.
Yeah. Luckily, we've kind of tucked our way into a totally different specialty in the baby world, which we're loving. But
yes, you're at the NICU.
Yeah.
What is that? What's the acronym?
Neonatal Intensive Care Unit.
Okay.
Yeah.
Or is there another one?
That's pretty much it. Yeah.
So babies.
Oh yeah.
And not as traumatic.
No, very
happier, because we're not like the most acute level of NICU either.
Yeah.
We're kind of like, what do you say, like a medium, like a level.
Yeah.
And acute is as far, does that mean like intensity wise?
Yeah. Actually, cut that out. Cut that out.
Cut what out? Sorry.
Yeah.
We don't want to be attached to our hospital.
Oh, did you say it right there?
Yeah.
Okay, I'll cut that out.
Thank you.
But yeah, we're not super acute, but not like super stable.
Yeah.
A happy medium.
And it's a very specialized unit, so we don't really get floated that often.
No.
We're kind of in our own little world in the hospital, which is nice. I feel bad at times that other units are struggling and short. We're short at times too, but it's a very different vibe.
Mm-hmm.
It's because again, it's when we're happy, like we're celebrating new life and parents that are typically excited. And
I was like, we've only ever worked with adults before this, so we've had no experience with babies, newborns, especially that are extremely premature.
Yeah.
And because of the staffing crisis, I was able first to get into the unit with no qualifications.
That's something that's changed a lot since.
It was very rare before pandemic. Like they wanted you to have all these courses and be certified and everything like that, which I didn't have. I was like, I need out of here. I need to try something new. I've always wanted to work with babies. So like I put my resume in, and I got a call as soon as the posting closed. I was like, what the heck?
Yeah.
So, I mean, I was shitting my pants to change from a place I knew for almost 4 years.
Because, like, you're starting over, too.
Yeah.
Baby, even vital signs are different. Everything is different.
Yeah. So, I'm like, I need to do this. I need to try it out. Nothing's permanent. And then I think, like, my first shift, I texted you and Mama. I was like, I love this.
Yeah. We have a group chat. We talk.
Yeah. So, and then I was just talking to you about how much I loved it. And it's such like a refreshing change. You see like these babies do well and get to go home. And it's just very rewarding and very happy most of the time. And then I think I finally got you to cave and come join me.
Yeah. Well, I'm obsessed with babies too. So I was like, it's inevitable. I might as well join you. And I was in an area that didn't have only 12-hour shifts, which is what I prefer. I'm a night owl. I don't mind the night shifts, but I prefer 12-hour versus an 8-hour night. So I followed her, and it's been awesome. I love our group of staff. It's a really small unit, but it's very refreshing.
Yeah. So it's the first. Well, my goal was to always work with Vanessa. I didn't know when, where, like it would happen.
Yeah.
So it's pretty cool that we get to be coworkers. Although we're still kind of like navigating being sisters and then also coworkers.
Yeah, it's kind of weird. Like when I'll see her at work, I'm like, "What are you doing?"
Yeah.
Oh yeah. Okay.
Yeah. Or like you gave. So I was working a day shift and she was coming in on nights, and I gave report to her.
Yeah.
Is pretty fun.
Well, it's not like you can confuse your patients. Be like, wait a second, I saw you last night, and now you're here again.
I know. Some of them do a double
talk,
take,
so.
but
Yeah.
that's the nice thing. They can't talk, but no, they're cute.
They just cry. That's kind of like our call bell system.
Yeah.
Oh, okay.
So what is that unit like? Like, what's going on in a regular shift?
So we'll have typically like anywhere from 2 to 4 babies. 3 is the sweet spot. And yeah, we just care for them in a 12-hour shift, 7 to 7. We feed them, again, a lot of support from parents. There's a lot of health teaching.
So the parents are there as well?
Most
Okay,
of the
so you're
time.
kind of interacting. I wasn't sure if they're like in an
Yeah.
incubator or what's
Some
going
of
on.
them, depending how small they are or how unstable they are, because we do get some unstable ones that we'll have to intubate and give them things like surfactant to help open their lungs if they're really premature, things like that. And then we've got ones that are a little bit older that we call feeders and growers that just need time to feed and grow.
Yeah.
And yeah, that's it pretty much.
Can we
Yeah.
talk about that baby with a missing you-know-what? Remember that?
Oh,
You know,
Well, as long as we're not
Yeah.
specific about where or who or...
he's like, what are you talking about? A missing butthole.
whoa.
Did you know that could happen?
That sounds detrimental. I think you need that, right?
Yep, you sure do.
Who was that? Was it you?
No,
Or
I
is
wasn't.
that-
Yeah.
Yeah. Yeah,
Well,
baby.
I didn't notice it. I was just there.
Well, I don't. It wasn't your
Patient.
patient anyway.
But like things like that can happen.
Yeah.
Like baby born
Where did
without
it
a,
go?
a
Just-
butthole.
Just not there.
You got to make
Yeah.
one.
So they had to be transferred to get surgery. And then there was another baby that night that didn't actually have, their esophagus wasn't attached. So it was like both ends of the GI system.
Weren't.
It was wild. I'm like, is there a
Connected.
full moon tonight?
Yeah.
I actually believe in that. But
Oh, wow.
So like it was kind of like a loop. Like they couldn't eat or anything because there was nowhere for it to go.
yeah, so
And-
it's a crisis. Yeah.
Yeah. So they
And-
also needed to go get transferred for surgery.
And they can fix that?
Typically.
Hopefully?
Oh, it's wild.
Medical? That's crazy. Just
know.
what
It's
they
amazing.
can, what they can do.
Yeah. Technology is amazing. But
We have the technology.
Yeah.
Just not the money to pay our nurses, probably.
yeah.
yeah. But it's very.
Nice.
fun.
Wow. It seems like you like this new unit then.
Yeah. Can you see on our faces? We actually seem happier than when we were
Yeah.
talking about the other
Yeah.
the other units. So
Which I learned a lot on my old unit.
yeah.
I feel like it helped me develop thick skin.
Can you say what unit you were on? As long as you don't say the hospital
Say
or
like the
anything?
patient population.
Yeah, like patient population. So it was like lung cancer patients.
Okay.
Specialty in thoracics, and then a specialty in like head and neck cancers. So like anything from here up, a lot of like artificial airways.
Okay, so it's like here up.
Yeah, essentially,
problems.
I cared for patients from the chest up.
Okay.
Yeah.
So no missing buttholes.
No missing buttholes.
That'd be a GI floor. Okay.
yeah.
Right.
Yeah.
Okay. Nice. And how many units, how many units are we talking? Like, how many different units? Is there 30, 20,
Oh,
40?
There's tons. Just think of all the different specialties in the body.
Oh my gosh.
Like I worked mostly cardiac surgery, coronary care,
Okay.
intensive care unit.
Okay.
But then you've got your, depending on what hospital, they specialize in different things.
Different things. So
So
if
you
you
got-
need to go to a certain unit, they just transfer you to that hospital that has that unit.
Yeah, like most hospitals can care for
Most things.
a large variety of things. It's more like the surgical kind of specialties that you get transferred for.
Okay.
Yeah. Like on my old unit for like the ENT, ear, nose, and throat, a lot of patients like say out here because hospitals like in Norfolk County don't have many resources. We got a lot of transfers from Norfolk.
Because it's specialized like surgical procedures and things like that.
Like, I don't
but
even think there's like a newborn unit here or something.
It might be really
No,
small.
like-
or it's very
I
tiny.
know they have a labor and delivery unit, which
Okay.
I almost like got
Applied
Like
for?
I got
Yeah.
hired, but I got cold feet, and I was like, no.
I was a
Oh.
student at this hospital. Actually.
Oh, really? In Simcoe?
Yeah, when I was an RPN.
Oh, nice.
Yeah, and their
Shout
maternity,
out.
they had like 2
Yeah.
beds or something. It was like maternity, medicine, and surgical ward all in one.
Okay.
Yeah, very small.
I spent a few nights there, and all the nurses were very lovely.
yeah.
Very lovely.
good.
So,
I'd hope so.
well, also, it was also my friend's mom who was my nurse for like a night or two. So there was that.
Oh.
She's retired now. But I was like, she walks in, I'm like, oh, I know you.
It's nice to hear though, like you had a good experience and like
Yeah, they were all really friendly, very professional. And like the one nurse that was taking care of me, because I had Rhabdo, and she was like, "Oh, I know what that is. My fiance had it, and yada yada yada." And the food wasn't that great.
no.
What
It's not top.
what is up with that? I don't like.
know.
I feel like nutrition is very important for recovery,
It is.
but it's just they're just giving you like Jello and white bread.
think it's a bit of budget.
Budget?
Yeah.
And like things that can be heated quickly and
And it's like,
Delivered quickly.
I don't know,
Yeah.
at least in the eyes of other people in the world, like Canada is known for the healthcare system. We have free healthcare and it's supposed to be like one of the top ones, but it's like, there's clearly a lot of issues
yeah.
going on.
Yeah. And there's a debate too, like public versus private healthcare, what's better. It's
Oh,
a
yeah,
lot of
that's like
countries.
Yeah, can we discuss that?
other-
Because I think when people say private, they're thinking, oh no, do I have to pay for healthcare now?
Yeah. So you think about the states, and that's private. Well, I think they do have public systems. Again, don't quote me. I don't know the American healthcare system, but typically it's privatized. So you pay insurance for a certain amount of coverage, and then I think you pay on top of that depending what you need, like having a baby's X amount of dollars or having cancer treatments X amount of dollars.
But right now, you can just go and have a baby for free, essentially.
Yeah, for Canada,
Yeah.
it's covered if you have a OHIP card and you're
Yeah.
a Canadian citizen.
So
Yeah.
are they trying to change that?
They've started with things like clinics to make them private. So again, if you're willing to pay to have something like a test or something a little bit quicker, you can.
Oh, to kind of bypass the
Yeah.
system.
It's unclear where the government's going. Again, I'm trying to keep my head out of that political
Yeah.
nonsense because I find it very draining. But yeah, for now it's public, but it doesn't function that well.
I would assume Doug is very big on private because he wants to make money.
Yeah.
Yeah.
But that's not good for the rest of everybody else.
There's pros and cons, I think, to both. Public, we all have equal access, equal care, but,
But then there's people who abuse the healthcare system.
yeah. So on one hand, if there was a price tag, people might be more selective when they come in or more maybe care for their bodies a bit better. There's a huge, maybe a shift in like preventative medicine. Maybe people would, yeah.
My worry is like, what if you don't have the money?
Yeah.
Yeah, that's a huge thing.
Like, what if you have an emergency and you can't afford to get a cast or
Yeah.
get surgery? Like,
But here in the States, people go bankrupt from having cancer or needing a surgery.
that is so messed up.
I
like,
know.
that's not a world I'd want to live in.
No.
There's enough financial stresses in life. Now, I do believe our healthcare system can be better, but
Could use a little zhuzh.
that would take a very long road.
Well, and the big one I hear just talking to my mom and my dad and stuff is not enough beds and like the system being clogged. Or my dad's a paramedic for those who are listening, and he will be on like offload delay, it's called.
Yeah.
So he cannot leave that patient because they can't offload the patient to the hospital.
Yeah.
Because there's nowhere for that patient to go. There's not a bed. So my dad can't leave that patient alone in the hallway, right?
Yeah.
You can't just drop them off.
So
Yeah.
if all these paramedics are on offload delay, then when
Who's
you call
responding?
911,
Who's on the road?
who's going to come?
No.
Yeah.
But it's like a domino effect.
I was just going to say that because there's not enough beds, but if we make more beds, there's not enough
staff.
nurse. Yeah.
Yeah.
Who's going to staff them?
But also the population's aging. Like our hospitals are old. They're decades behind where they need to be.
Yeah.
And decades behind where we're supposed to be in the future. Look at the boomers, baby boomers. They're getting to an age where they're requiring more medical care.
The boomers.
No, it's true.
know.
Like our parents, they're
I
getting
know.
to that age where things are starting to become issues. And we do not have the structure, the staff, the capacities to deal with it. So our ERs do get overwhelmed. We don't have enough family doctors, not nearly enough. Like, I know a lot of people even our age that can't find a family doctor, and we're young and healthy. So it's, yeah. And then you have things like nursing homes that are full. So the hospital is full with a lot of patients who maybe might
Need to go,
require.
Yeah.
Well, and I think the boomer generation is like probably double ours because,
Yeah.
you know, Nana and them were having 5, 6 kids, and now the boomers are having maybe 2 is probably the average.
And a lot
Yeah.
of our generation are considering even not having kids just from a strictly financial perspective,
Yeah.
trying to be smart,
Mm-hmm.
So it's tough, right? But yeah, they need to expand something. I don't know. It's a mess.
And
It's a hot mess.
does
Stay
it
healthy.
do you know if it varies from province to province, or is it kind of like a nationwide medical system
I think the themes are the same
Yeah.
from coast to coast.
and training and things like that, and the system? And
Yeah.
But it's still like a huge shortage.
he might drink
Oh.
your drink, but if you're okay with that,
He wants some of the burnt out nurse.
he is a whiskey cat.
Is he?
He likes the whiskey.
Okay, he's like,
Allegedly. Allegedly, I let my cat maybe lick some whiskey here and there, allegedly.
He's
Nobody
what?
actually
He's like, how old is he in cat years?
I don't know. He's
Old enough
he's
to
going on
party.
11, I think.
Old enough to party. It was so funny when we came in and Drew said how you like wipe the counter or the table and there's like all his little footprints.
Yeah, it's just Cooper prints.
Yeah.
Yeah, I wipe it down. There's a little paw print.
To make his
Yeah.
presence known.
You can see him. Yeah, I have to get him this tree, otherwise, he doesn't leave us alone.
Oh, he'll just go all around.
Or meow his face off. We can't shut the door. He'll meow his face off.
I
Yeah,
love it. It's like a guest.
and then you'll let him
Pops
in. He'll be like, "Oh," and then he'll leave.
Just wants to know that he can.
Yeah.
Yeah.
He'll just want to go in rooms just because the door's closed, and you open the door, and he's like, "Oh, that's in there. Okay, cool." But he'll meow for like 30 minutes, 45 minutes until you open that door.
Let me in.
I love it.
But he's a savage.
He is a savage.
Dogs must be good for trauma.
Oh yeah. Well, I have a 4-year-old Golden Doodle. I got her just as COVID was starting.
Good timing.
Yeah, which
Great timing.
good timing because someone was usually home to train her.
Yeah, I still lived with them at this point. so-
Yeah. And I was studying for my license exam. But yeah, like she is probably like the best form of therapy. Like if I had a rough shift, I'd come home and she's just so happy.
She has no idea what you went through. She's
No.
like, "Hello,
I know.
pet me.
Yeah.
Animals are
Throw this
just-
frisbee."
Yeah, and like it's crazy how smart they are too. Like if she could like sense like if I like had a tough day or upset or frustrated about something, and she'll just be like a very calm, like she's energetic as you both know. But like she'll just run her face off and like have her zoomy moments, but it's like they know when you need just like that calming.
A hug.
Yeah, when you need a hug. So
Or a nap.
probably
A
like
cuddle nap.
the best thing that COVID brought to me was Paisley.
Your pupper.
Yeah. Oh yeah.
You got any? You gonna get a dog or?
No, Rachel has enough pets for the both of us.
That's true.
She's got goats,
Goats,
Chickens, ducks,
cats.
cats.
Oh yeah, you have ducks now.
Ducks?
Yeah.
Oh.
That's why I said I just go there, get my animal fixed, and then I go home.
Yeah, we actually were able to train our ducks.
What?
In what way?
Yeah,
Okay, so I'll have to preface this. So there's some funny stories. So my now fiance Jeff and I recently got
Congratulations.
engaged.
Congratulations.
Thank you. I really wanted ducks because we have a pond at our house, and I just think it'd be so pretty to like watch them swim or whatever. But there's like coyotes and stuff out there, and I don't.
Raccoons and-
Yeah, like I don't want them to get eaten. So we had these like 2 pair of ducks, a boy and a girl. And then the weather was getting nice. So I was like, oh, let's just put them in the pond and then we'll put them back in the barn at nighttime. Do you think we could get them out of the pond?
They loved it.
They would not come out. So like we just let them out there, like left them overnight, and like they were fine for like a
You'll
week.
see.
And then the male duck went missing.
Oh boy.
So I was like, oh, frick. So there's Jeff and I in our hip waders going in the middle of the pond
Looking.
with long, like pool nets trying to catch this duck. Oh my gosh. So we finally get her. We put her back in. I get another male duck from the girl that sold me them. And then we essentially trained these ducks where we would keep them in like a little fenced in area. And in the morning we'd let them out, and then at sunset we'd put them in their little house. And then once the weather got nice, we just like let them free range. And now sunset, they all like
They come back.
They waddle
Aw.
to their house.
It's so cute.
so
cute.
satisfying. But like the length. Oh, like the other day when we did let them out for the first time, we're like cooking dinner, and then I look out and I text Jeff. I was like, I don't see the ducks in the pond. There's this like creek that attaches to our pond and like goes all the way up. They were in the creek swimming. So then we're running in the farmer's field, like I'm on one side, Jeff's on the other, with the big pool net trying to like get them to turn around.
Corral the ducks.
And then Paisley, our dog, actually like herded them back. She
Oh,
went
really?
into the creek behind them and then like led them back
Come on,
to
buddies.
Yeah. It
Oh my
was
gosh.
it was a time.
It's like
Was
your
she-
goats too. They listen also. It's weird.
Yeah. Does she
Yeah.
herd the goats at all?
Yeah, like I think she just wants to be one with any animal that is like walking around the property. But she'll herd the goats. Like she like tries to play with them, but
Yeah.
yeah, she's pretty smart.
Poodles are supposed to be one of the smartest breeds of dogs. So
that.
she's
Smart dog.
Yeah.
yeah.
Mom's
I mean,
a poodle, right?
Some people have mixed feelings on, like, they call doodles mutts and how you shouldn't.
Mixed breeds or whatever,
but she's the best, so I'm a little biased.
no, that's awesome. You have this little like sanctuary to go
Yeah.
home to.
Yep.
But then you got Adam, so there's
Yeah.
that.
Yeah.
I said I'm the city version.
Yeah.
Rachel's the country version.
and just I used to be the city.
We all used to be city.
Yeah. Yeah.
Hamilton represent.
Yep.
Oh wow.
Yeah.
Have you always lived out here?
Born and raised, yeah.
Yeah.
Simcoe.
Nice.
It's a nice
Yeah.
little oasis out here.
We have like we found out we have a mutual relative somehow.
Yeah, we're related down the line.
Oh.
It's like
Your mom's
cousin
is my uncle's
something like that.
something.
They married.
Yeah,
Yeah.
Uncle Jeff. My Uncle Jeff.
Nice.
Yeah, married someone from my family.
Yeah.
I mean, our
Something-
family's
something
huge, so
like
it's
that.
kind of
Yes. So we're like unrelated,
All over the place.
fourth cousins, twice removed
Yeah.
podcast hosts.
Nice.
so we're all related.
Well, this would be on my mom's
I'm
side,
just
so
kidding.
Family party.
Yeah.
family party. Hold on, I want to check.
Except Coop.
So I did I put something out on my story, and I
Coop's
had some
adopted.
people send some questions in. Give me a second here.
I feel like we kind of just rambled for a while.
Yeah.
No, it's great. I wasn't sure where to go, and I didn't want to keep it too structured.
Yeah.
Yeah. This drink is delicious.
So, Amy, our mayor, is asking, how do people get into healthcare nursing as a career? And can I elaborate on this?
Yeah.
Mhm.
What piqued your interest in the first place?
Into
wa-
nursing?
Yeah, to want to even go into this.
It's funny because I wanted nothing to do with nursing.
I always have to do what Vanessa does.
Yeah. We do everything
Okay,
together.
no, yeah, you start.
No, I actually wanted nothing to do with nursing because, like Drew said, our family dinners were nothing but like medical talk. And I was like, oh, I don't know if this is for me. But then in high school, I was in the hospital for something and I had a really nice night shift nurse who I let practice an IV on me. And I was
I
like,
remember that.
You
was like,
let someone practice just like,
I'm pretty easygoing.
yeah,
She
you can
thinks
stab
otherwise.
me.
No,
No,
I'm like,
no, you are.
with stuff like that. Yeah.
Like when I was in nursing school, they give you like this lab kit to come home and practice with, and
Homework.
she showed me on herself, did it herself, how
Vanessa.
to take blood work.
she wouldn't poke me. So I was like, fine, I'll show you. And I poked my own arm.
Yeah. Just like.
Anyways, what were we talking about?
Oh, why do we want to get into nursing?
Oh, yeah. So then I had this really nice night nurse, and I was like, I want to be just like you. And I was a night owl, so. And yeah, I wanted to go to school for art. My mom's like, just get a good career.
Piece of peach. They're
Chunky
not
peach.
in season yet, so they're not
A little
as bushy.
snack.
But yes.
You know, it's good to have a snack mixed with a drink. But
So you had an incident in the hospital.
yeah, and I
That's-
really liked the idea of being a night shift nurse. Night shift specifically, because I was up all night anyways. So
Yeah, you're a bit of a night hawk. Yeah.
Did
yeah.
you like have an area where you were like, oh, I really want to work here?
no.
No.
But again, a lot of our aunts were nurses. Your dad's a medic. Our mom's in the medical field too. So I was like, I guess I can get some cool stories to contribute at Christmas dinner. And, you know, it's a good career. There's always jobs. And I was like, oh, I love art, but I can do it on the side.
Mm-hmm.
So then I decided to do the RPN program because it's a 2-year course. And I was like, if I hate it, then I only wasted 2 years of my life.
Mm-hmm.
I loved it. So I ended up, well, maybe love is a strong word, but I liked it a lot. So I ended up bridging because I knew I wanted to work in critical care areas. And yeah, here we are.
And you're fine with blood, apparently.
Yeah.
Oh, yeah.
Yeah.
I'm.
Yeah.
So you would
Honestly-
practice IVs on yourself.
Well,
That's
one time.
Yeah.
I've let students poke me before.
Uh-huh.
Again, I don't know if I'll get in trouble for this, but
Allegedly.
they need to
Yeah.
learn. I'd rather
Allegedly.
them practice on me than a poor patient.
Yeah.
You know? Yeah, no, I'd be willing to.
And did it work out the first time, or did they miss? Because
Oh,
veins. My understanding is some people are like, you can't bind the veins, and like me, you can see every single
Yeah.
vein in my
Yeah.
arm.
No,
Like
ours
you-
are.
hidden.
I was in
Yeah.
the hospital last year. I had my appendix out, and the ER nurse told me my veins were worse than a cancer patient's.
Oh my God.
That's
Yeah.
not a compliment.
No, and I was also really
it's not.
dehydrated, so
What do I hold here to get the veins? Oh, yeah.
You don't even need to hold anywhere.
yeah, yours
Drew.
are popping.
Yeah, I had a nurse miss my vein once, and it was. I think that's why maybe I'm squeamish. I was a
Yeah.
child, and I was getting blood work done, and I remember just like she went in, and she was just like swishing the needle around. And I just was
You
watching.
You don't
it,
want a
like,
wiggler. That
yeah,
hurts.
Even
Yeah.
my dad was like watching. He's like, "Okay, that's enough." Like,
See, I can see
you
your
can't
veins
find
from
it.
here.
I know.
Yeah, I don't know. Maybe they've
did she
grown.
miss? Was
it just
when
for
I was a
blood work?
child. It was just for blood
Oh,
work. Yeah.
That's
easy.
annoying.
Yeah.
Yeah.
But
But anyways, that's how I ended up in nursing.
I was either between teaching, because like as a kid, I would always pretend like I'd have my little classroom in my room and whatever, or something in healthcare. Did you guys-
You'd be teaching the Barbies, and then I would come over and push them down the stairs in the convertible.
Yes.
Yeah.
Yeah. So it was either that, but I think just being in our family and everyone was in healthcare, I think that's kind of what helped me guide my decision.
Job stability and
Yeah, like
decent wage to start. And
isn't like the nursing degree, aside from like business or something where you can get a job straight out of your degree, like kinesiology, you can't.
Yeah.
You typically have to get like a 2-year program or something else to.
Yeah. No, it's taken me years to realize, but a nursing degree is quite versatile. Like, you don't even
Yeah.
have to work in a hospital if you don't want to. You can work with research. You can work, like, for a university like we do now. Again, we needed experience, but yeah, you can do all kinds of things. You can work for tech companies. Peak COVID, I actually almost went back to school to work for tech.
Oh, to like administer like vaccines and like how does it?
No, like, I was more going into school for things like things to do with data or like
Okay.
artificial intelligence.
Okay.
Just think of all the robotics and stuff used in surgery alone, and like,
I did interview someone for work who was a
Machines.
nurse that got her master's in business.
yeah,
Yeah.
a lot of
At-
people do that too.
Yeah.
Yeah, but the informatics thing was huge. But that's when I was like peak burnout, hating nursing.
Peak burnout.
Yeah.
The,
Yeah.
the burnout.
The
Yeah.
burnout.
Nurses burnout. So what
Nurses
about like
burnout.
injector nurses, like cosmetics?
Oh, that's a
do they?
huge-
Yeah, that's a huge industry, but also like quite saturated now. Like lots of people are trying to go that route because they don't want to do bedside.
And it's a
or-
nice like cushy like. Well, if you have clients Monday to Friday, you know, you typically don't get that dirty.
but you have to like build up your clientele. I think initially, like, because you have to spend money on like the medication, and initially you don't make that much. But if you build up a really good clientele, then
Yeah, and you can't just do it by yourself. You need like a nurse practitioner or a doctor to oversee.
yeah,
Yeah.
and to prescribe and.
But no, it's a huge thing. Like, I get a lot of students who want to go into aesthetic nursing.
And 2 of our friends do it.
Yeah.
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 Are we talking like Botox and things
Yeah.
Lip fillers.
Yeah.
Yep.
All that stuff.
It's the only other one I know.
Yeah. Like
I
I
don't know much about it.
not cosmetics, but I tried like an infusion clinic for a couple months. Just giving like some of them are like chemo drugs, some of them like may need iron infusions if they're anemic and they come weekly or
like that? Okay.
things like that. But it was the way it was run was actually quite unsafe. So I'm like, this is my license. Like I had to man the whole clinic, do all the paperwork. Like a patient was developing a reaction even before I started. Like they had like a pre-med to give. Then they started becoming really hypotensive where their blood pressure drops. So I tried calling the on-site doctor and no one was answering. So I had to wait until I stabilized her and then send her off in an ambulance to go to emergency.
She was there by herself.
And I was there by myself.
How do you stabilize?
So her pressure was really low. So I
Okay.
just laid her flat and then she had fluids going. So I just let the fluids keep going through to help
Okay.
bring her pressure up.
Okay.
But that's usually like step 1 and 2. And if that doesn't work, then you're kind of screwed.
Yeah.
Yeah.
Well, not screwed.
Well, you
but-
need help. You need assistance.
Yeah, but there's limited resources in that little clinic. So I tried that. Like it has the potential to be a really good job, but
How many doctors are on hand on a unit usually if you need to call one?
It depends. It depends if it's a teaching hospital like we've always worked in versus like out here like a community hospital. Because we've got doctors, residents, fellows, like all different levels.
like physician
Yeah.
assistants.
So where we are, it's pretty easy to get a hold of somebody.
Yeah.
Yeah. But I'm sure in the smaller hospitals, not as much.
My instance was pretty quick, but I went in with chest pain, right? Ended up being rhabdo,
Yeah.
but they were like, boom, here, this test. Doctor showed up. He was drilling me for questions. And he was like, "You do cocaine?" I was like, "Nope."
You're like, no.
I guess hard drugs causes rhabdo sometimes.
Yeah.
Okay, so he was like, "I need to be honest with me. Are you doing hard drugs?" I'm like, "No."
Yeah.
Yeah.
But I just started weightlifting and I did yoga and I did this. He's like, "Oh, you should have told me that."
Yeah. Well, or like excessive exercise.
Yeah,
That was you.
that was me. Do you know what rhabdo is?
I was gonna say, is it too late to ask? Is it when your hands were blue, or is that
No, that's
Raynaud's?
that's
Raynaud's,
Raynaud's, yeah.
whatever.
Okay, I thought it was the same thing you were talking
No.
about.
Do you want to describe what rhabdo is? You probably do a better job than me.
Rhabdomyolysis. What is that when
that's
you're...
the full.
I feel like you might want to Google it. We'll try our best.
Yeah,
But
look it
it's
up.
Essentially when your body starts to break down
Yeah.
Like it's
muscle.
like it's
Yeah,
muscle
and
tissue
then-
essentially.
Yeah.
It starts injuring your kidneys because your kidneys can't filter.
Yeah.
And then it just builds up in your bloodstream, which can be extremely toxic.
There's too many what's that molecule
Oh, it starts
called?
with an M.
Like I thought it was like C something.
Oh,
Serious.
No.
So rhabdomyolysis, often called rhabdo, is a serious medical condition that can be a fatal or result in permanent disability.
You almost died.
Rhabdo occurs when damaged muscle tissue releases its proteins and electrolytes into the blood. These substances can damage the heart and kidneys and cause permanent disability or even death. So CK, is that what they called it?
Creatine
Creatine.
kinase, yeah.
So it's supposed to sit around 1 to 200. I
Yeah,
think
you were like
20,000. I was
Yeah.
at.
You were
So
That's a lot more than.
yes. So I was like, what does that mean? Like, do I have damage now? And they're like, well, you should be fine. But like, if you came in a few days from now, like
Yeah.
you would have like kidney failure.
Well,
They said.
And what were
I-
the symptoms? Sorry, go ahead.
No, you continue.
I had chest pain that started up here. And then I was like, oh, that's weird. Maybe it was from working out or something or sports. And then it started moving. The pain moved.
Oh, whoa.
Like moved down my arm and then up over here. And I'm like, okay, this is weird.
Like through a day or like.
like an afternoon into an evening.
Okay.
And then I was like, well, I'm just gonna go in.
Yeah.
So they're like, I walked in. I was like, hey, I'm having chest pain. They're like, get in here. Started doing like the sticky stuff.
Yeah.
ECG is
Yeah.
it? ECG test, and then they did an X-ray because I have like a very skinny build. So they're like, oh, maybe something to do with your lungs. Wasn't that? And then the guy started drilling me for questions and stuff. And then he's like, okay, before you go, we're gonna do a blood test. And then they were like, oh shit, you have to
I'm
you
glad
have to stay.
they did that.
Yeah.
It was just that one day and it just kept,
It's just a one day.
okay, so you didn't wait.
Well, my arms were really like extraordinarily sore. Like it was sore to like pick up a bag.
more than normal.
More than normal. Like I was like, this is weird. Maybe I went way too hard. But then I don't know. And then it just didn't go away. And then the chest pain started.
You're
And
like,
then
something's not right.
Well, I'm glad you went in.
me too.
Because were we away or someone?
Yeah, I think we were.
Everybody was away. My parents were
Yeah.
away. So yeah, my aunt and uncle. No, Kathy and them came and brought me food and checked up on me and stuff. So
Yeah, I had a patient that actually went to ICU intubated. And then they came to me afterwards, but they had rhabdo and extreme kidney damage where they needed dialysis,
sheesh.
which essentially dialysis it helps filter the blood
Yeah.
Machine.
because your kidneys are so damaged from all that buildup.
Yeah. I asked. That was my worry. But he's like,
Yeah.
he's like, I wouldn't be concerned. Like, if it continued throughout the week, then yeah, you would have major damage. But
Yeah.
I got in
Scary.
just in time.
It's scary.
8 bags of fluid, I think it was, over 3 nights.
8 bags of fluid.
Yeah. Like saline.
1 bag is a liter.
Into my arm.
Just a lot. To flush it out, right? They're trying
Yeah.
to flush everything.
Yeah. And I was just like, I just started weight training for the first time since before the pandemic. Did hot yoga, drank the night before. I did the sauna. I was at Jura. did the sauna.
No, you didn't do this.
So I did like all these things consecutively in a
Yeah.
row, and I just went too hard, I guess.
Your body was like, nope.
Yeah,
Yeah.
didn't drink enough water, didn't eat enough protein, like just a mix of different things. But
So
then the
now-
doctor's like, "Are you doing cocaine?" I'm like, no, I'm
You have to
not.
rule it out. I
Yeah.
mean,
Yes.
So now you're probably a lot more careful.
Yeah, I eat a lot more protein now, and I drink a lot more water.
That's good.
Yeah.
And no more cocaine.
No more.
Yeah.
No more
No more
cocaine.
cocaine.
Yeah. Cut the cocaine out.
Yeah.
Yeah. I'm just very cautious. Yeah. But now, like, I've been weight training for like 6-7 months now, and it's like I'm kind of in the swing of things.
Good.
So,
Good.
yeah. Yeah. Rhabdo.
Not fun.
No, not fun. Not fun at all.
I've never had a patient with rhabdo.
No.
I've had two. One that was like more extreme, and then one that was kind of your level, where I kept her and was flushing fluids, and she really wanted to leave. I was like, girl, you don't want to leave yet. Like, your levels
hang
are
in there.
still super high.
Yeah, I was at 20,000, but I guess people can reach upwards of like 100,000
Yeah.
CK level.
I feel
Which is,
like
like,
hers was
absurd.
higher than yours.
Probably, yeah.
Well, because she did like a spin class for the
Oh,
first
it's from
time.
a spin class.
Like, you're quite an active person where
Yeah.
like she said she didn't really exercise much, and then her friend brought her to a spin class, and then that all happened.
It's good for people to be aware of, though.
Yeah.
Be aware of rhabdo.
Yeah.
I don't know, like, is my body type more prone to it just because I'm skinnier or?
That I don't really know
Yeah.
much about the.
Like, I know your body type would be more prone to pneumos.
What is that? Oh, the lung thing.
Yeah, when
That's
you're
what my dad got.
yeah,
Yeah.
with his little chest tube.
Yes.
That was before I even was I in nursing? But it's funny
You're in
because
nursing school.
I then went on to a floor that specialized in that kind of stuff.
Oh, can we? I think Drew doesn't know. So do
Type
you want to
in
just? Yeah, tell him how to.
pneumothorax. PNEUM.
My dad had this actually.
See the
So
second,
the second one,
down.
yeah.
It was listening.
Pneumothorax. A pneumothorax is a collection of air outside of the lung, but within the pleural cavity. It occurs when air accumulates between the, what am I saying? here?
Parietal.
Parietal and visceral.
Pleural.
Oh my goodness. Inside the chest, and the air accumulation can apply pressure to the lung and make it collapse.
So again, with your slender build,
Yeah.
you're more at risk with.
It's like air between the lung and the chest cavity. So that's what they x-rayed me for. Because I was having chest pain. They're like, oh, maybe it's this.
I wonder, because I think your dad had a pneumostat put in. I wonder if it would show like what it looked like.
Yeah.
So yeah, take out thorax and then put pneumostat. Chest drain.
Oh, yeah.
Yeah.
Try that one. Because there's so many different types of
Go to
chest
images,
tubes.
maybe?
Yeah, go to images.
Is there like an X? Do you have to type X-ray maybe?
Oh, if you scroll down, you see how it's inserted into the side.
Oh, yeah.
Yeah.
So is that like a forever thing or just like for
No.
a bit? Just
Yeah.
the air
jab
out.
it up there and drain it?
Yeah, it's temporary.
Because you can get a chest tube to drain things like air, fluid, pus, blood. Yeah.
I've seen them do that in the shows with,
Yeah.
Yeah.
with like a pen.
Because I don't.
Yeah,
Yeah.
we don't use pen.
You don't use hollowed pens?
No.
Only in emergencies.
Yeah.
I don't think my dad's lung collapsed, but it was like close.
Yeah, I don't remember.
But he did have to. Yeah, he had to get surgery and get that put in.
Yeah, I remember him having a little device on him at the time. I didn't know what it was, but now I do.
Now you do,
Mm-hmm.
and I guess you can get it from like trauma, like physical trauma, like car accidents can cause.
Like blunt forces.
Yeah, blunt
Yeah.
force can cause it
Yeah.
because you're like crushing your muscle tissues.
It's very humbling to be the patient, let me tell you.
Yeah, I need to knock on wood because I was about to say I've never been a patient.
Yeah.
But you have had your fair share.
Yeah. I had my appendix out last year.
Mm.
That was fun. Not.
You said that was the most pain you've ever experienced, right?
Yeah. I thought I just had a lot of gas.
Oh,
Thought I had an upset stomach.
Yeah.
You know, I tolerated it for like 3 days and I was misdiagnosed at urgent care center.
can we
It's
can we go through that whole story?
That's got to be frustrating.
And obviously, don't name
As a nurse.
hospitals and don't be
Yeah,
specific, but
yeah,
but
but-
there was some serious issues.
Yeah,
going on there.
it's tough too because being a nurse, I don't tell anybody I'm a nurse when I go in for care for myself. But again, we kind of know what to anticipate, so it's tough when you go in thinking one thing and then they're not doing it. You want me just to run you through the chronicles? So,
It's like a pretty good case
Yeah.
scenario.
we got time.
Just cut us off if we're talking too much. I started getting stomach pains, and I've had a pretty sensitive stomach most of my life. So I was like, oh, it's just a stomach pain. I got Adam to get me some Gas X, thinking, you know, whatever, maybe it's that. I was curled in a ball on the couch. I actually had to call in sick the next day because the pain was so bad. And I had
Is it like, was it pressure?
It was just like this pressure in the upper middle of my stomach, and I'd had pain there before. So I was like, okay, did I eat something weird? Like I had food poisoning before. I'm like, I don't think it's that. I just didn't really know what it was. But again, I'm not the type to run somewhere and get checked out. I was like, okay, I'll see how it goes. But then after, I think it was 24, 30 hours of not being able to eat or drink anything.
You just like vomit.
I started vomiting bile. Like it was bad. So I went into urgent care because I didn't think it warranted a trip to the emergency room. Within like an hour of closing, so they weren't too happy with me, but all I wanted was just a quick little, checkup just to make sure, maybe, am I making this up in my mind? Am I crazy? So they did my vitals, and I remember the nurse telling me, they're not going to do anything for your stomach pain. They're just going to tell you to go home. They're going to tell you bye-bye. And I was like, okay, cool. And she didn't know I was a nurse. I don't tell anyone. So I get in there. Immediately the doctor is like, we're going to draw some blood work just to make sure. They did my vitals. My pulse is usually quite low. My pulse is normally like 50s.
Are you a vampire?
I think so.
It's a low resting heart rate.
Normal heart rate 60 to 100. So my pulse was high 90s. Now, someone just looking at that would think that's normal. For me, that's quite high. So again, it didn't get flagged. I got in, got some blood work done. They wanted to do an ultrasound of my stomach. The machine wouldn't turn on. So they tried it a few times. Machine wouldn't turn on. They're like, okay. They gave me some pain medicine and sent me home. They failed to address my unable to eat and my nausea and things like that. And I was like, okay, whatever. So I left. The pain got a little bit better. In the morning, I came back for a proper ultrasound, which nothing was flagged, but I was in the most pain I'd ever been in my life. They had to give me a narcotic. And then they sent me home with a prescription saying I had a bladder infection because there was, I think, something found in my urine. Looking in my chart later, it was a very trace amount, so very small. So I was like, okay, this is kind of weird. A really bad stomach pain is a bladder infection. I'm like, weird. Never had that before. So I had the narcotics. I went home, slept for a few hours, and then woke up again. I was like, this does not feel right. My stomach, like I actually thought my insides were trying to die. So I went to the emergency department, just explained everything because now it had been going on 3.5 days of this pain and not eating, not drinking. And that's where the nurse couldn't get my IV. Apparently it was a really hard poke. But yeah, they did a CT scan and right away found that my appendix was inflamed and they booked me for surgery within a few hours. So luckily I went in. It hadn't ruptured because if it ruptures, that causes a whole lot more complications.
Like she could become really sick.
Yeah, you can get
a perforated.
You can get quite septic. Because just think something that's inflamed and it bursts and now it's circulating in your abdomen. So yeah, luckily I had surgery that morning and I went and I was quite impressed with the surgical team and the care and working post-anesthetic unit. I knew what to expect, but I'd never had surgery before, so I was quite terrified, but it was probably a good thing I hadn't slept in a few days because I was a little delirious. Yeah. But yeah, it went well. I went home that afternoon. I was kind of my own nurse, but...
Well, because I remember you telling me, because they don't know, nobody knows where this was, but the nurse, didn't she forget to do vitals or something? Yeah. See, and then you made a comment, and you're like, aren't you supposed to check my vitals? Yeah. I checked them, by the way, they're fine, but
I think they were scared of me because they knew I was a nurse.
Oh, they did know.
Okay. They knew, somehow they knew. Okay. I don't know how.
Well, didn't the one resident know you or like, Vanessa... or something.
I can't hide. This is a problem.
Yeah. Well, because it was at the hospital you used to work at.
I used to work there, so I was like, okay, hopefully no one knows me by now. I was wrong. But yeah, they were kind of scared of me. So then I remember the doctor coming in and he was discharging me, and I was a little eager to go home. It probably shouldn't have been discharged that quick, but I was like, look, I've been walking, I've peed, my incisions look good. And the nurse came in to take out my IV and send me home, and I was like, and she was a new nurse, and I was like, you might just want to check my blood pressure. Yeah. Just to cover your own butt. I'm sure it's fine. But please just take my vitals. She's like, oh, okay. And then I was like, don't worry, I've peed. My incisions look great. My stomach's
all
fine.
Like the criteria
I've eaten.
You're training as a patient.
Yeah, I'm like, I've eaten. I'm doing laps on the ward with, my mom was there, and we were walking around, and she's like, oh, okay. And then did that, and then sent me home, and...
Did you kind of feel like you're on Undercover Boss? Feel like
a little bit, yeah.
I'm a nurse, but I'm not gonna tell you.
She's got a mustache on there, like
I actually
you don't recognize her.
Actually, a nursing student took care of me that day, and I think they were terrified. But I was so sleepy, I was one of those patients. I'm like, no, I'm good.
I don't know, but I think, I don't know if I was a nursing student and I was taking care of a patient and they said they're an instructor, I might shit my pants a little bit.
I didn't tell them, but they knew.
She's gonna be grading everything
I'm just gonna put
doing.
this needle in your arm.
Yeah.
Yeah, no, it was very humbling though to be on that side of things. I said because I worked post anesthetic carrying unit or PACU they call it, and a lot of abdominal surgeries we give gas to inflate the stomach. Well, not we, but like in the operating room they do. And the patients are always like, "Oh, it's so painful," and we're always like, "Yeah,
just get up and walk.
just walk. Once you fart and burp, you'll be fine."
Because you want to move that gas around, right?
Girl, that was the most painful thing. Those incisions, like I couldn't even laugh without crying in pain. It was so. I said it's very humbling now, caring for patients. Mind you, they're babies now, but when I care for adults, it's
I think when I came over, it was like the day after, or 2 days after, and you're like, "Oh, let me get you a coffee." I'm like, "How about you sit down?"
I think I pushed it too hard.
Make myself a coffee.
Yeah,
because you were quite sore.
Every like 2 hours, I'm like, I need to walk around so I don't get blood clots. And again, when you're a nurse, you know too much, and you're hard on yourself. So
I was gonna ask, like, was it scarier just you knowing more than let's say me?
Yeah, well, because again, I know the things that can go wrong. I was, you hear those stories of people waking up during the OR and all that stuff, but. No, I had a great experience. The anesthesiologist was great. The one that puts you to sleep. The surgeon was great. Like the whole team. I was actually quite impressed. So
I'm scared to if I ever have to go under anesthesia. I just be like, I'm not going to sleep.
Well,
doing it.
Yeah.
I was actually terrified because I have a history of myasthenia gravis, which is an autoimmune condition, and I was nervous with anesthetic agents if that would like trigger it. I haven't had it in a long time. But I think they were like, what is this chick talking about? Myasthenia. And I'm like, the neostigmine and stuff used for it. They're like, how does she know these words? And I'm like bugging them. And I'm, again, delirious. Hadn't slept in like days. And they're like, I think you'll be okay. I'm like, but please just make sure I don't stop breathing.
They're just like, what did we give her?
Yeah. Should we double it to make her stop talking?
Yeah. I was way too chatty. But
that's funny.
I only got put under once for like to remove a tooth that was attached to my jaw, but I was like, when does it kick in? They're like, oh, just count back from 10.
Yeah.
And I don't remember hitting 5.
Yeah.
I was just like,
I love getting put out.
See, I got my wisdom teeth out, and I was adamant. Like, I didn't want to be awake to listen to all, like, the drills and whatever. Yeah. And I was like, are you putting me under? And they're like, yes. I was like, I asked, like, probably 3 times. I go in. I did not go under. I listened to the whole thing.
See, I like being aware. If I could watch my surgery, I would.
I don't want to be aware.
Me neither. I'm on your team.
you're a very unique person.
Mm-hmm. Well, I read my chart after, and it's like, oh, patients now in Trendelenburg. And I'm like, oh, cool. Like, this is how I was. And then
it's just a crazy concept. Like,
it's like your body
to go in for surgery, but you're completely vulnerable
and
on a table.
Yeah, you have to trust these people with your life. And I'm like, people do that with us every day. I'm like, this is bizarre.
I know.
Yeah. Cut my stomach open. Well, laparoscopic. We don't cut. But
Laparoscopic.
Yeah.
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 That
Through
means
a camera. They put it's like a video game for your.
Oh, sweet.
Yeah.
Oh, is it like it moves?
Like
they
they
can
do
control
little
it?
like incisions to stick the camera.
Yeah, there's
in.
like little poke holes. I got a few poke holes. And then they use these machines, and it's like on a screen. And it's laparoscopic. A lot of the surgeries now, you don't come out with a big incision anymore.
Okay, well.
Which is nice.
Better for healing time.
Yeah, because they're not like opening and going in with their
yeah.
hands. They're going in with a tool.
Yeah.
Yeah.
Okay.
Yeah.
Crazy. I feel like it would be easier to do if you just opened it up.
And look at everything you're working
think.
with.
It's like a picture of probe lens.
Yeah.
Remember the probe lens we used on that
Yeah.
shoot? Like they're using that to go in and then cut the appendix
Yeah.
out with it.
Yeah, but it'd be way easier if you just had a wide angle, just saw everything, right?
It's a big lens.
Camera
It's a
talk.
big lens. You got to go in there. Wow.
Yeah.
Nice.
I don't even know what we were talking about.
Your appendix story.
Oh,
That's my story.
Yeah. I have a friend that's an optometrist, and she went in for LASIK surgery, and they forgot to give her the drugs that kind of like take you out of it. So she's like fully conscious for the surgery, and she's an optometrist, so she knows everything about the eyeball while she's getting this stuff done. And she's like, I can smell my eyes burning and all this stuff. And
Okay,
I was
that's
like,
horrible.
Yo. And I said, was it more terrifying just like knowing everything about the eye? She's like, yep.
Yeah.
Yeah.
They just forgot to give it to her, I guess.
Ignorance is bliss.
Yeah, I was just gonna say that.
Yep. Sometimes not knowing is
Yeah.
better.
My dad asked, what is the most difficult part of your training, and do you have any tips and tricks to succeed?
What is the most difficult part? Aside from being like, say, new to a unit or a specialty, I think maybe just integrating with the team.
And I think, like, never being afraid to say you don't know something.
Yeah.
Because you never want to do something that you're unsure of, because these are humans.
You have to kind of just leave your ego at the door.
Yeah.
Yeah.
Like when I moved units from adults to babies, I felt like a student again. I was like, oh my gosh, like all my experience and my knowledge just like out the window. But I just kind of accepted that what I don't know, and I will eventually, and that our careers are like forever like an evolving like learning experience. So,
Not being afraid to ask questions.
Yeah.
Yeah, similar. I'd say the same. Because again, I come with 8-9 years of really intense adult experience, and now here I am. I'm like learning everything over again, like basic stuff, but it's very humbling. I think stay humble.
Yeah.
Yeah.
And that you're also one person too. Like I know like me and you are very hard on ourselves sometimes. But you're one person, you do what you can do, and at the end of the day, if your patient is stable and is breathing, I would say that's a win.
That's a win.
Yeah. So I think maybe going back to like COVID times of when I first started training, the most difficult thing was just like the forever changing of like policies and navigating like just like this is what we're doing now if we get these COVID patients, and this is what we have to do, and when you're just trying to focus on like
basic nursing care.
Yeah. So that was probably the most difficult part.
Kind of gets clouded by all the policies and regulations and crap like that, but it's fun to look back on now and be like, oh, those COVID times.
Yeah.
We're actually laughing about it at work the other day. Like, how weird was it?
I know.
But
Like, I was terrified for you, and I didn't even know what it was like.
yeah.
I feel like too you got to experience like 4 or 5 years of nursing before the pandemic, and then I walk in and just like everything that people were missing, like potlucks and
The fun part.
just like the fun part of nursing that like every Christmas that like I've worked the past like 4 or 5 Christmases, and just like I don't know, they were like, you're not allowed to bring in food or just like the thing, like to make it more enjoyable when you're away from your family.
Yeah.
Like you did a lot of fun stuff with your old unit before that.
Oh yeah, we celebrated everyone's birthdays, and
Yeah.
you know, it's bonding or things outside of work, which was very much frowned upon during the strictest COVID times.
Yeah.
But yeah, that's how you bond, and it's fun because you're friends with these people.
So that's something that I missed out on, and now it's slowly like have come back.
Yeah.
Which is nice.
Yeah.
But
because there are a lot of nice things about nursing.
Moving forward, if there is ever a pandemic again, are we?
I didn't want to think about it.
Are we better prepared? Like, what are some things we can do differently than what we did for this one?
I don't think we'll ever be prepared.
No.
Because what was the one before that? No, SARS.
Yeah, not people. Don't listen to
But
me.
just like how different they treated that, and then how different they treated COVID.
Yeah.
I think, God forbid, if something else were to surface, it'll probably be so different on how they tackle it.
The one thing is I don't think people will freak out as much. I think our mental capacity will be a bit better. Like maybe we'll be able to cope and actually like think a bit more clearly. But
Because the last big one was like 100 years ago. It was but nobody's around to remember it.
Right.
So it's like it's not as fresh
Yeah.
in anyone's minds.
no, I don't know if our systems are there. Considering we're short-staffed on a good day.
So more staff.
More staff, better resources, but again, we know it all comes down to money. Like a lot of the equipment needs replacing. We finally started getting new beds, like basic things that we need better of, but I guess we'll see.
hopefully we won't see.
No, hopefully not.
Yeah.
Yeah, I don't think so.
We just want to care for our babies and
And COVID was a
have a grand old
SARS.
time.
It is a SARS, like
Yeah,
SARS-CoV-2.
Yeah.
respiratory.
Yeah.
Yeah.
I don't think about it much anymore,
Yeah.
to be
No,
honest.
well,
I
that's
just,
good.
like,
Sorry
push
to
it.
bring it back up again.
Oh,
That's
that's
okay.
okay. It's good to kind of.
Like we teach our nursing
Debrief.
students, it's good to reflect because then
Yeah.
it's how you process things and move forward. But
Yeah.
Yeah.
My question to you guys was because I was listening to a podcast and this person was talking about how AI is slowly replacing radiologists because they're getting better at identifying cancer on X-rays than a radiologist, like a human being is. Have you noticed AI? Is it in your workforce? Have you noticed it at all? Are they introducing it? Is it
not from the nursing
not
standpoint.
from the nursing standpoint?
No.
And again, technology is expensive, so I'd be very surprised if they were willing to invest in robots to do our jobs.
Yeah.
But I think they would have to come a long way to take over what we do.
Oh,
Yeah, like physical robots at bedside.
Like we've
Oh
seen,
yeah,
That
yeah.
would be
but
like-
for reading tests and stuff.
Yeah, yeah.
or I've seen the little machines in some hospitals where they'll like collect blood work and like wheel them around,
Oh,
get on the
yeah.
elevator, go and deliver stuff.
Oh, that's there now in the hospitals.
I've seen that. Like it's not super common. Again,
Yeah.
I don't know beyond our facility, but
It's like
But
at the
this-
sushi restaurants they have that.
yeah,
robots.
yeah,
But
think
for blood,
similar like that.
Like
right?
R2D2 just driving around blood samples.
delivering sushi or blood samples. It's probably the same company.
Yeah.
It's just like
Yeah.
spring roll,
Yeah.
type A, B, blood.
That's so funny.
But yeah, no, I haven't really seen
No.
it too much yet. Yeah, if anything, more with like the computery side, like our charting systems.
Oh yeah,
But
yeah.
again,
that-
it's millions of dollars to upgrade.
Yeah, and that was a long time coming because everything was like paper charting.
Yeah.
Like everything was paper. Now we have transitioned to everything digital.
Yeah, when I started nursing, everything was paper.
And
Oh,
some
really?
hospitals are still only paper.
Mm-hmm.
And what is like when you say paper? What are you keeping track on there?
So like doctor's orders, they'll write it, and we have to decipher their scribbles into
boy.
what they're ordering. Versus at our hospital, they type it into a computer, and we literally just click to acknowledge, make sure it makes sense, and
Yeah.
you can like communicate better. We can send them like it's like a messenger. Send them
Yeah,
a message.
little memos
Hey,
and
you know, I have this issue or this blood work's out of whack. Can you have a look at it? Versus paper, you have to page them. You have to have them call back, write the order down,
wow.
Yeah, it minimizes a lot of errors.
looking for information too, because you have
Yeah.
a binder. Can you find the binder? Probably not most of the time to, read some notes about the patient.
So there is still paper systems right now.
Yeah. I taught last semester in a facility that used
Yeah.
paper charting.
Oh my gosh.
And it's
Yeah,
a
it's
bit
crazy.
more, I find it less safe because
Oh, that's why I went to a hospital that was electronic.
that was my
as a
biggest
new grad. Yeah.
Yeah.
Just because like you're shown like all the medications, what you're giving, the orders, like things like you get notifications. It's just like it's a nice safety net, especially for someone navigating it for the first time, like taking care of patients and not a student role.
And when you're giving medications and you're scanning them, I don't know, some may argue it takes away a bit of the critical thinking, but I think it's a good double check.
Yeah.
Just to make sure, okay, I'm
Or if you
scanning
just
it.
graduated into a pandemic.
Yeah.
Yeah.
Or if you just didn't sleep well that night and now you're, double checking. Oh,
Yeah, or you're trying to corral your ducks out of the pond or
Yeah,
something.
I
Like,
was up late in the
Bringing
middle
the
of the
ducks
pond
in.
with my hip waders on. Oh man.
before we wrap up, anything you want to say to people who are thinking about getting into nursing?
Don't listen to the negativity you hear online. Like you mentioned before, there's so many different avenues you can do with your nursing degree that and honestly, like bedside is not as bad as people make it out to be. Like some like medicine floors, like nurses love working on medicine, like they love the grunt work. And if that's not your thing, you can work in an office or like it's just such a versatile degree to have that I always encourage. Like if you're interested, and
Yeah.
don't listen to like the
My-
negative.
Yeah, I agree. My pieces of advice would be you have to actually like caring for people.
That too.
You can't do it just for the money.
Yeah.
Because it's, a decent wage and things like that. But yeah, you have to do it because you actually care a bit. My advice for the people that are already in it and that are feeling burnt out still, don't be scared to make a change because trust me, I remember looking at anything but nursing to get into, and it took all I needed to do was change units, try different specialties. So Don't be scared whether you're a new nurse starting out. Go for the specialty that you want. If it's something that gives you passion and makes you feel good, then I say go for it.
Mm-hmm.
Yeah.
Nice. Good advice. Okay, well.
I did have one question.
Yeah,
Yes.
hit him.
Yeah.
Hit him with it.
You talked about people going to the right spot when they have something wrong with them. Like there's emerge, urgent care facilities, walk-in clinics.
Yeah.
How would people really decipher which one they should go to, and how would they find out? Because I've had that trouble, like going to like trying to find a walk-in near me, and there's like
Yeah.
this one's open Tuesdays and
That's fair.
Thursdays, and that one's open. Like, is there resources or like?
Well, to start, everyone ideally should have a family doctor. So for little bumps and bruises, or if you think you have like an earache or a strep throat or a blood pressure issues, you go to your family doctor, ideally. Clinics have since taken the brunt of that work.
Mm-hmm.
And then just to clarify, urgent versus emergent. Urgent care is for things that maybe you broke a bone or twisted your ankle, or you think you have
A decent cut or something.
a
like that.
decent cut that
Yeah.
needs a few stitches, or you need you have an infection that needs antibiotics, things like that. Versus emergency, it's like I'm having chest pain, or I'm having trouble breathing,
Or I'm weak on one side.
yeah, or I'm got in a car accident and
Yeah.
now whatever. So there's a different level between urgent, and it's like you will be okay, versus emergent. That's a bit more life threatening.
Going to die. That was my
Yeah.
biggest thing. Was
Yeah.
I didn't know the difference between urgent or emergent.
Now, you're
Yeah,
not going to
which
get
is
in
fair.
trouble if you go to the wrong
No.
place. Like our mom works at an urgent care center, and a lot of people come in with acute issues like chest pain. They call them an ambulance and they take them to the hospital because they just don't have the resources or the supports at those places. So they will adjust as needed, but that's like my biggest takeaway, I think. Is there
Yeah.
anything you want
No, I think you
to add?
pretty much hit it all.
And aren't they allowing like pharmacists to diagnose like low things? Like if you have like strep throat or something, I don't know, you always have to go to the
I think some pharmacies, they can write scripts now.
Yeah, I'm not.
It's hard to keep up.
not
even for
sure.
like just poison ivy or something. I think. I don't
Yeah.
know if that's
Yeah,
a thing.
I
Like UTIs
feel like
and-
things that are like pretty like black and white, that maybe they can.
Like here's my poison ivy.
I got poison
Yeah,
ivy
yeah.
for the first
Instead
time
of like
need
last
going
summer.
to can I just
We
get
need
some
like a
cream?
hub where people can go in and be like, what? But there's telehealth too. There's too many things, I think. That's why people get confused,
Yeah.
Just try and use your brain, common sense. What level of care do I need? If you're not
But
sure,
also,
call.
like he said, some clinics are only open certain
Yeah.
days, and
Yeah.
I don't know. It's just if you can get to those places too, or
Yeah.
there's a lot of factors that play into
It's a lot
where
of
you go.
moving parts, which I don't blame why people get confused.
Yeah.
Yeah.
It is confusing when you hear urgent care.
Did that answer your
Seems
question
urgent.
at all?
It did.
Okay.
Really good.
Kind of
I had a
I know.
stroke. That's urgent.
Yeah,
Yeah.
no, seriously though.
Emergent.
So
It's
that's
an
an emergency. Yeah,
emergency.
you're
And then
you're off.
another thing is too is people think of like the emergency room. I'm gonna sit there and wait for hours, so let's go to the urgent care.
To try
And
and
then-
cut the line.
Yeah. So and then like that also clogs up the urgent care because now this like emergent case of like chest pain comes in, they'll need to tend to that person 1st, and then
Over you who has a boo boo.
yeah,
Yeah.
yeah,
Because in the emergency, they have a triage system where they go by most acute. People who essentially need to be seen first. So, yeah, you could have 10 people come after you and they're all more sick than you and all be seen before you. And some people can't cope with that.
yeah.
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 Life.
Angry people.
Life. Good
Yeah.
question. That's a
Yeah,
good
thank
one,
you.
actually.
Yeah.
That was good.
There's also I feel bad. I don't know if I'm paying into like the private system, but when there's like those apps now
Yeah.
where I've been on like an app and say like I have strep throat, can you send me a prescription, and then they just send it
Oh,
to
yes.
shoppers.
Yeah.
It's like $80
like the
or something,
telehealth
but
stuff.
yeah, they can
Yeah.
like diagnose certain things over webcam.
yeah, this is just like an app. I think it's called Maple.
Oh, really?
There's a bunch of different companies that are.
See, I haven't even heard of. Like
Yeah, no, I
that.
know because I had
It was just
applied
for
to a
something
few.
where like I knew I had strep throat. I'm like I get it like once a year almost.
Yeah, that's
This
like
is
me
what it
too.
is. I know if I have to wait a few days to get antibiotics, it's
Yeah.
just gonna make it longer.
Yeah.
Where I'm like I can just do this app, give
Yeah.
someone some money, and
And get your
get
script
my
and
script
treated.
right away. Yeah.
See, and again, a lot of people aren't even aware of what they can do, right?
Yeah.
Technology.
Internet, yeah. It's wild.
Just think of the gaps in the different generations, how much one might know versus the other.
Mm-hmm.
You know.
Yeah, I was
Well-
teaching my dad about Spotify the other day.
Oh, yeah?
Yeah.
Did you show him our podcast?
No, I didn't. I didn't.
What the
I
heck?
didn't. I asked him about a podcast and it went right over my head. I don't even really see this as like, for me, it's just hanging out. It's fun.
Yeah.
Like when people are like the podcast, I'm like, oh yeah, fuck, I forgot.
It's your social time.
Yeah, we're just hanging out.
I had
It's
some
fun.
girl come up. You were there. She came up to me. I was talking to, it's Ryan, right?
Yeah.
Fist bump Ryan.
Yeah.
She came up to us at yoga and it's like,
Stephanie.
oh my God, I love your podcast. I've been listening to it. No idea who it is.
Oh,
Yeah,
I was like,
she's
that
so
was
nice.
kind of cool.
Yeah, that is cool.
shout out to her.
Oh my,
Yeah.
210 followers or something like that. But
Yeah.
we're getting there. We're growing.
Gotta start somewhere.
Exciting.
I love it. I can't wait till you guys are famous.
Yeah.
We'll see.
Yeah.
One of the ones that were on it.
Oh geez.
I
Yeah.
love a good podcast.
You're within the first 10. This is number 8 or 9, I think.
Really?
Sarah was the last one,
I
right?
guess, yeah.
She was number 8, I
7.
think. Or 7.
Because I remember saying
Number
7
8.
was her number.
Yeah, you're within the first 10.
Top 10.
Very exciting.
Mm-hmm.
Yeah, and I'm just kind of like digging into my personal network, really.
Yeah.
And then hopefully it'll grow from there. And we have got a lot of DMs actually, like, oh, I'll come on. So
Oh,
I'm like,
that's
okay,
cool.
yep, keep you in mind.
Yeah.
Yeah, because I schedule pretty far out, so.
Do you ever like have difficulty thinking of like, okay, I want this person for this topic, or is it just kind of?
No, it's just a matter of like scheduling them in, and I'm trying to not put 2 similar people back to back.
Mm-hmm.
Right.
So I'm not gonna have like my dad on next, who's medical as well.
Right,
So I'll
right,
try
right.
to space it out.
Yeah. I'd like to watch his.
Yeah.
That'll be a funny one with your dad.
Yeah.
Oh yeah,
That'll be a good
and I want to get Nana on as well. So
Yeah.
Boy,
that'll be a good one.
that would be interesting.
She's like, I don't have anything to talk about. My mom was like, Nana, you have a lot to talk about.
Yeah.
You're 85 years old. Like, you have stories.
Huge like.
Grew up through the war and the Great Depression and
It was
like,
a police dispatch. Like
Police
the
dispatch.
stories. Oh my
Mhm.
gosh.
Yeah.
Yeah.
She's lived
She's
a
got
life.
a lot to talk about.
yeah. So maybe I'll just get her to listen to this one since you two are on, and then
Yeah.
Yeah.
she'll be like, oh my God, this is so cool.
Yeah.
I'll make her a drink. Probably,
Yeah.
probably just be, what is she like, Pinot Grigio?
She likes beer with
lime cordial.
Yeah.
Oh, okay.
Hmm.
All right. Well, maybe I'll have to do that then.
Yeah.
I don't know what that is, but I'm excited.
Lime, it's like a lime syrup
Yeah.
sort of.
in beer.
In
Is
beer.
that normal?
Ah,
I don't think so. She likes it.
Likes a little flavor.
little flavor flav.
in your beer.
It's like
Either
putting
that
a
or a
lime in your
tea.
beer.
Yeah. Okay.
Yeah.
Yeah. Or tea or sweet wine.
It's like the syrup version of a lime. I
Yeah.
guess. It's like,
Cool.
yeah.
I can wrap my head around.
Yeah. Yeah. Well, if you ever want to come back on, let us know.
Yeah, this was a lot of fun.
It was
Happy to
fun.
have you
I
on.
don't know why
Yeah.
we were nervous.
I know.
I told you, you just kind of forget. We just talk and have a
Yeah.
good time, and
Yeah, it went by fast. What time is it? Wow,
Yes.
it's 3 on the dot.
3 on the
it's
dot.
2 hours
Uh,
goes by
Yeah.
fast.
Yeah, it does.
Anything else you want to say before we wrap it up? Be a nurse.
Yeah.
yeah. We
Come
need,
join us.
Yeah. We need nurses,
Yeah.
but do it because you want to.
Yeah. Not
And
because you
it's-
have to.
Yeah. There's good and bad with every job, but you know.
Yeah.
Yeah.
Are your Instagram accounts private? Or are you okay if I tag you guys? Like, what if people want to ask you questions and things like that? Is that
I
okay?
think mine's
Yeah.
private.
I'm
but-
private, but you can tag me.
Okay, I'll
Yeah.
tag you guys.
Because then I think you get what? Message request if someone that
Oh yeah.
like you're not following tries to
Yeah.
ask you something.
Just wondering if like someone is as a nursing student wants to ask you questions.
Yeah,
or
100%.
something.
We love nursing students.
You want to be like that nice resource or support for
Yeah.
them if they need it.
Okay, cool.
Mm-hmm.
I will tag your Instagrams.
Mhm. And maybe we'll have them in our clinical group one day.
Ooh.
Imagine.
I listened to your podcast.
Yeah. That's so funny.
Yeah.
All right. Thanks so much for coming on.
Thank
Thank
you.
you.
Yeah,
Yeah,
until
thanks
next
for
time.
having us.
Thanks everybody.
Cruise.